Welcome to CoexSpace Mental Health Summit. I am Vivian Toussier, your host. At CoexSpace, we believe the mental health crisis is not only personal, but deeply collective, a sign that our societies have drifted away from balance, presence, and empathy. These questions invite reflection on how we can restore inner and social equilibrium through awareness, connection, and compassionate action. Milton Wainberg, we're so honored to have you here at this Summit of Mental Health, Invisible Emergency. Thank you for being here.
Thank you for having me.
I will start with your short bio because you have been doing so many things in the mental health field. So I'm waiting for this conversation and to know your point of view of this world that we have right now and the mental health society we live in. So you're a professor of clinical psychiatry at Columbia University in New York State. And you're a doctor leading global experts in mental health, implementation science, working to bridge the gap between research and real world care in a low and middle income countries. We spoke about this in our last summit. Your work focuses on expanding access to evidence based intervention for mental health and substance use disorders, particularly among vulnerable communities and individuals affected by HIV. You also direct the Columbia University Global Mental Health Program, leading international collaborations to train mental health professionals and strengthen public health systems worldwide. We cannot be more honored and grateful to have you here at this summit and to know what are your perspectives and what are the most common myths about mental health and what would you wish to people that live in this contemporary world to know about mental health?
Thank you again for having me. It's a huge question. Mental health is something that we all need. The problems of mental health are basically not taken care of anywhere. When you look at how an illness can create burden, mental illness is one of the highest burdens. The diseases that creates burden. They have measured the burden of diseases in the world, and in 1990, when it was first measured, mental health problems, mental illness, were number one or two in any country. And since then, it hasn't changed. Other diseases that were very high up now are getting better care in mental health. We are in the same place everywhere, number one or number two in the burden of disease, which means it impacts people's not only about the illness, but in their functioning. It impacts the individual, the family, society, education, work. So having mental illness and having no access to care or having difficulty getting access to care makes it a very burdenous disease. We have not been able to not allowed to make sure that what we discover that works gets used in the systems of care. So even in rich countries like the United States, 50% of people who have a problem are not getting care. In poor countries,
Wow.
between
Mhm.
75 and 80% of people don't have access to care, which it's even worse than not getting good care. They don't have access. And the problem that we have is that the system is not changing. Discoveries are not getting used. And we continue doing the same thing no matter what. The stigma of mental illness has been there forever. Got a little better during COVID because people became more aware of the issues related to mental health. But the funding to take care of mental health is very, very low in every country. And unfortunately, because of that, there's not enough resources. There are not enough professionals to provide mental health care. So what I'm describing is awful. There's no money for it. We don't have enough professionals. And the professionals that we train are not necessarily well trained. They don't take care of the population the way they should. The poorer you are, the worse are the conditions, even in high income countries. The access to care in private practice, when people can go to privately, but the system needs to provide. So the world has not really taking care of mental health for multiple reasons. In a world, as you're saying, that it's more complicated now than it was in the last few decades, we have higher levels of disorders in many places. Any type of traumatic situation increases the rate of mental health problems, and we're having many of those all over the world. We need a transformation. Part of the work that I like doing is to figure out how to transform systems and work at the system level to be able to do that. It's not an easy task, and it's not happening as fast as it could and it should be, but there's still hope that we can improve it.
Can you describe what are the most myths and mental health problems that you see in the school, in university, with your professionals, in your clinic? What can we understand about mental health, not being a doctor, not being there in the middle of that data? And what do you see in the future? Idealistically speaking, and maybe in a reality pace of the advances.
To know what are the most common disorders, we know that depression, anxiety are the most common disorders after traumatic events, PTSD, post traumatic stress disorder. But by the way, you can have trauma and not get PTSD. And not everybody that isn't exposed to trauma gets PTSD. But sometimes what people get is depression and anxiety. So the rates of disorders, the highest ones are depression, anxiety, then trauma. Then you have other disorders that have lower level of presentation, which are, more severe disorders, psychosis, bipolar disorder. The communities are suffering much more from depression and anxiety. However, the people who have severe disorders have much more needs than the people
Mm.
who have depression and anxiety. Suicide is rising among the young population, and we're not very good at taking care of that. So the picture that I'm presenting is a very negative one, and it is a negative one. I'm not making it up. The tradition of how to provide mental health care has not taken into consideration advances that we have made. We don't expect people to get trained in the things that need to be done, and we have not been smart enough to figure out that we need to train the workforce to have other people besides mental health specialists taking care of people. Not everybody for a cut needs to see the plastic surgeon. Well, maybe in the hand, but you don't need to see a plastic surgeon for every cut that you get. Not everybody needs to see a mental health provider. The problem is that the systems and the mental health providers are afraid that they're going to lose their jobs. And we think that the quality of care will be lower if it's not done by mental health specialists. That's not the case. We have plenty of data from all over the world that even high school people can take care of people with low to moderate problems. And if until we
Wow.
organize ourselves to do that, only the rich will have access to care and poor people don't. Worse than that is that, a perfect demonstration that we're not doing a good job in systems of care when people, after waiting sometimes for months, start treatment within sessions 1 to 5, depending on where in the world, people leave. And it's not because they're better. It's the people that basically the system, they don't feel that the system is providing them with what they need, and what it's expected in the treatment is something that they may not be able to accomplish, like to come weekly and et cetera, et cetera. So if I want to be idealistic, the ideal would be that government and communities work together to figure out solutions that do exist to improve access, to train people to do more community care, and others to be more in the severe disorders care, and to have the people who are the specialists expand not only to provide treatment, but to actually be trainers and supervisors of others who are not mental health specialists. And by the way, as you do that, those people will choose to become mental health specialists. So you would also increase the number of people that at one point would become specialists. So the possible solution is there. It requires a change in the system. It requires a change of mindset among mental health professionals, among those that, I'll give you an example. Let's say that you talked about HIV or you have hypertension. You go to the doctor and the doctor evaluates you and immediately says to you, Milton, you need to take this medication or this medication. Or maybe, if it's hypertension, what are things that you can do to lower it, right? But at one point, you need to have criteria for what medications to give if you need them. In mental health, it's not like that. In mental health, it's very dependent on the individual giving you treatment and what they think they need to give you, which might not be based on true guidelines. So the system is not well prepared to monitor what people do when they provide mental health care. And we who provide mental health care don't monitor how our patients are doing. It's more how we feel they're doing. And I know that it sounds terrible, but it is not going very well. We need to become much more precise in how we assess
Mhm.
people, much more precise in what treatments people should get. And we have an opportunity that we can do that, and we should, but it requires that people put their heads together to do it and funding, which is decreasing for mental health. I know I painted a very dark picture. Sorry.
No, but thank you. I believe and we believe in order to change, we need to see the truth. And after we see the truth, we can gain some understanding of what's happening so that we can fix it or improve what we're experiencing, which is the truth. As you said, mental health has been very badly supported by society, especially in this society that we look for other perspective as money, work, maybe too much to do, and very lonely society in some places. In other places, we find more union between families and communities. And I've seen that. I've seen that. I've been in other places. I'm a psychotherapist. I'm not a psychiatrist, but I've seen what some things that work. And while you were speaking, I was thinking about supporting groups, like AA programs, other programs. We spoke about suicide, and there are groups for suicide, families, or the families surrounding the mental health, which is mental health problems are family problems, and you know that. And like you said, can you describe what is for you a system and what would a healthy society would be so that maybe we're not politicians, we're not, doing those politics, but we are the community. What would be your guidelines for us to do to start working on what are the most common things that make mental health disorders or, reasons for somebody to be in a depression, anxiety, suicidal thoughts? You think nutrition influences or not? You think the education system? What would be for you the main reason to develop a mental health problem?
The question is very important. And I'm also thinking, what can you do within your system, within your family? Because not everybody has access to impact the world. Actually, very few people do. I wish I would have a little more so we could do more. A few things are very important. Number one, we should not be afraid of mental illness. We should not be afraid to talk about it. We should not be afraid to ask, of course, in the right way and with people that you love. Many times people see people suffering and they don't know how to ask them what's going on and to figure out how to help. And suicide is very common because of that. So create an environment where conversation is available and you're not afraid to ask. If you're suicidal and I don't ask you, it could also mean to you that I don't care, which makes your risk even higher. Loneliness is a very important problem. So you talked about how societies can create systems not dependent on the health system, not dependent on the government, that communities can take care of themselves. And it's very important that communities think about it. And not only the majority of the communities, but also the minorities in their communities. Because sometimes minorities are the ones who are suffering the most because feel much more isolated. So in
Mhm.
a family, being afraid of these things, which is very normal, is not the right way to do. Doesn't mean that I'm going to ask you every day, are you suicidal? It's about asking how you're doing, creating and creating an environment where you could tell me, Milton, I'm not doing well. And it may be that you need help or you may need support, and then we can figure out what to do. I do think that the more community care we do, the best it is, because the idea of going to a hospital or going to a setting requires an effort that it's complicated. And the problem with it is that nowadays the system is created that we wait for you to come to us.
Mhm.
System has not done early detection, early intervention, which is much better than late detection and late intervention. In the systems, we wait for people to come to us instead of us going to the community, teaching, being able to do prevention and early detection so we can do the care before the impact is so much more negative. But we need to be able to talk about it because otherwise, we're blind or we want to stay blind. And that doesn't mean that we don't care. Sometimes we feel is people are afraid to talk about these things.
Yes.
People feel, for example, that talking about suicide makes the person feel more suicidal. Absolutely the
Mhm.
opposite. If you open the door, people will talk and will ask for help. And it doesn't mean that you're going to be able, that you have to take care of the person, but it's much better for you to know that the person is suicidal to ask for care than not. So asking the strong or difficult question doesn't make the person do worse. It's quite the opposite. And that happens not only in families. There's data that shows that people who attempt or complete suicides have been seen by a health provider in the last months and even a mental health provider, which means something, we're doing something wrong, that
Mhm.
we're not paying attention, that we may not be asking the correct questions, even within the systems of care. The moment that we take away the fear is one big improvement, because that also means that I'm not afraid to tell you. It's not that you're afraid to ask me. I'm also afraid to tell you, what do you think about me? Are you going to think less of me? So the stigma and the negative way of looking at mental illness, it complicates our ability to take care of people. Families and communities can do things. Obviously, when there's severe disorders, we need to seek care, but creating an environment of wellness, which could be, in multiple ways. We also know that social determinants of health, and what do we mean by that? Your access to healthcare, your access to, finances, housing, food, are very important things. So the worse are your conditions, you may have more problems with mental illness. But that doesn't mean that you have mental illness. And it's the other way around too. Mental illness can impact your ability to have income, to eat properly, to live in good situations. Communities can help with that. Number one, paying attention to those that need help. So I believe that societies that are very individualistic, it's much harder for people to find where to be. In communities can be easier, but also if you're not discriminated for something else that you could be discriminated. What do I mean by that? When you have a community that a majority is A and there are a few Bs in there, those people also need to feel that they belong and they're free to then be able to have opportunities for themselves.
That's a very profound statement because we need to change our paradigms and the way we think about mental health and open these conversations and take away the stigma and maybe open the doors for the reality. And that's why I'm so grateful you're describing the truth, which is happening in every household, in every school, like you said, in hospitals, in every community, you find a lot of mental health nowadays. So I would like to understand the work you're doing towards getting those results of opening these conversations to create more tools for mental health. And what are you doing right now in the work field to change the way we are right now? And what do you think we can do to create those environments that truly supports emotional well-being and resilience?
Great question. Not because of what I do, but because we need that. The moment that we stay away from stigma and we don't see the person with mental illness as less than, as a weakness, it's not a weakness. is something that they have, and they need to figure out, like with any other problem, how to treat it and how to get it better. The work that I do is about trying to change the paradigms, as you well said, to transform how people look at mental illness, to see it a responsibility of all of us that we need to do something. I've been very lucky that I've worked in different places with communities, with anthropologists, with sociologists, with psychologists, with social workers, with people with lived experience who are the people who can really tell us what they go through, with relatives. And the idea is that everybody has to be involved in this plan to make sure that it's a good plan, a healthy plan, that it's feasible and acceptable and appropriate for the communities and for the people and for those that are going to provide care. So there's a gestalt of, we need to have a mindset together that includes everybody, because if we exclude the patient, then they're not going to do it, right? We need to be included. And it's not that complicated. It sounds big, but it's actually quite simple. It does require not seeing as a weakness, as a stigmatizing issue, et cetera, et cetera. So the work that I have done is trying to figure out, number one, what is the easiest way to assess, because it can be very difficult. The questionnaires in research are enormous. We've been very lucky that we know how to ask with 3 questions, that you may have a problem. With 10 more questions, we can categorize it, and then we can go further to figure out what to do. Those can be done by, in poor countries, by community health workers. In not so poor countries, you have community people who can work with that. You can do it in churches, you can do it in synagogues, you can do it anywhere in community settings, as long as there's a connection to where to take care of you if things are not doing well. So it requires like a network, or a lattice, actually what you have behind you, right, of connectivity, that would allow that if you ask and you take care, you also know what to do if things are out of your hands. And we need to train communities to take care of things that are low to moderate. Another thing that is coming ahead of us, which needs to be, and everybody's afraid of it, AI, right? Artificial intelligence. Everybody is very afraid of it. And sometimes you should be afraid of it. When you have tech people who are doing things without the specialists in trying to figure out how to do it the best way, that's a problem. And because things sometimes sell faster than you do them, there are many things that get created that don't have exactly what you need. But with AI, you can do amazing things that people can have access, for example, on their own, of knowing how they're doing. So there are applications that it can tell you, Milton, you're more in the depressed side. Milton, you're more in the anxious, and without asking you any questions. There's several applications that you can do that, and I'm working with some people, behaviorists, to do that. And that is a way of, you can monitor yourself to ask for help. And if you allow that to be connected with your providers, also for the providers to know that something needs to be done. We're not doing that yet. With AI, you can also figure out how people can do things on their own in a more hybrid way, that they can access and do some work on their own. And if they need care, to be able to do more hybrid care. So there's some possibilities that are opening up of what needs to be done. They have to be well regulated. They have to be properly monitored. And that would be an advance to be able to really move, even beyond the systems of care, right? Because it is outside. Obviously, some poor countries, not everybody has access to cell phones, so we need to figure out how to work with them. Although cell phones are growing and growing and growing in most countries. In some countries, actually, they do free Wi-Fi for everybody. Somehow we don't do that in many other countries, neither rich nor poor. And by having that, you are completely opening the world for somebody to have access to things that are not just mental health, by the way, right? Having internet or Wi-Fi connectivity allows you to have, it's a completely different. Imagine nowadays that you are the only person in your household or in your community that doesn't have access to look at anything. You are suffering. And so there are some things to look forward to, that there's, with good creativity, people can take care better of themselves, and if necessary, go further. So for example, you use AI with a particular therapy that it's well vetted, people, we know that it works. at one point with AI can, and with the measuring how you're doing, can tell you, it's time to look for somebody. You are at a place that you need to move to the next level. So the idea that we can give you what you need, and if you need more, we have the way of getting it to you. But AI can help with the beginning portions incredibly. It's not yet as developed as I am saying it, but I believe that we're going to get there very quickly. And some of us are working in that area. And for me, the idea that, healthcare should be free for everybody, including mental health care. And if we're really able to think how to monitor, if you have diabetes, you have monitors that tell you how you're doing. And based on your monitors, you know what's going on. But then at one point, it gets transmitted to your doctor, and your doctor knows. We can do that with mental health. We can do that. And it's not costly, probably cheaper than I'm pointing this as if you have the diabetes measure, the measurement that you use for diabetes care. It's about us thinking and paying more attention to these than we do with others, with other illnesses. So I painted a very negative. I think that there are solutions at every level with number one, early detection, knowing you and others what's going on, feeling comfortable with that. AI could be a response to the beginning stages to even motivate you to get care, to take away the stigma as you are trying to look for care, and to guide you how to do it, and to have the system work with AI like they do in diabetes. If you're using these, your people who are taking care of you need to know that. So there's a learning curve that needs to happen, that the system has to decide to learn to, and not just the technology people to deliver it. We're very afraid of AI taking over. I think that we need to look at that too. But in the meantime, there's so many things that can help in the process. The most important part is that once you have an illness, the system has to have a better way of taking care of you, because the community will not be able to do it. The family will not be able to do it. And you need at one point to get the care. So there's a line of with mild to going to more severe. And if we can put along the way what you can do in a way that we all know how to do it, it will be a much productive way of helping people. And we can get there. I think that we can get there. It requires a different mindset, but it's changing. I think the fact that AI can make, money, then there are more companies trying to do that. It's important to vet what's being done and that it has evidence. And I think many of the startups that do not so good job, they die because it's clear that they're not doing what they need to do. And there has to be some regulation that if you're going to do something connected to diabetes, it has to be correct. You wouldn't have an app of diabetes that tells you to eat more sugar, right? You will follow what needs to. So there has to be a method of to keep track of what's being developed, what can be done. We do that with medications. We should do the same thing with AI and have a process of giving has the quality to be able to be used and not just to be used. So there are opportunities that are coming to us.
And we're walking forward towards that. And as you said, AI is a tool and we can use it for good or for bad. I believe many we are looking to, transmit this type of information, which is how to use it in a right way, what to look for instead of just scrolling or being more lonely instead of that looking for solutions. I've seen people looking for other solutions that medications, as psychedelic therapy, as mindfulness, meditation, body somatic therapies. I would love to hear your perspective about the different solutions for mental health. What would be your best to go to?
It's a difficult question because I believe that there's more than one answer. And I believe that you don't need to do either or. You can combine things. That's one of the things, if you eat well and you're healthy and you exercise, that is helpful, but it may not be enough. And to think that that's the only way to do it, the same way with medications. People are afraid of medications. I prescribe them so I feel comfortable with them, but not everybody feels comfortable with them. But it's not just medications, right? And the idea that you can combine things as long as we know that they work. Psychedelics, there's treatments that now we use that, years ago we thought that no, we couldn't do that. And there are very clear treatments that are being used that are very helpful for people. You describe the use of the phone, right? Actually, since we have more social connectivity, the mental health of adolescents has become worse. Mental illness can start around age 14. And what we create in a system of isolation and self-criticism and comparison that you on your own are creating can be very, very damaging to adolescents. And we don't regulate it. It's hard to regulate, right? I've tried with my children. Sometimes I've tried with myself. It's very hard to control these. And you see people walking in the street, it's so funny how people walk like this. And they can be missing an opportunity of somebody very nice that they could be meeting, and they might
Yes.
even know the person and they don't see them, and then they get offended, blah, 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 blah. We depend too much on that. It's a very addictive because it's fun or it's interesting or it's distracting. We don't regulate it. It would be important for families to know how to regulate it for themselves because it would be very hard to regulate it by governments, et cetera, et cetera. I am a believer that you can use anything that we know works. This is not about dogma that only this is the way to do it. Whoever tells you this is the only way to do it, I would turn around and ask somebody else because there's
Hmm.
more than one way. And even, the fear of medication, there's some points where as people look for care, and they may get better. But if they don't get better, we need to think of medication.
Hmm.
You would never, again, going back to hypertension, right? If you are at a level that you're not there yet, less salt, healthy, et cetera, et cetera. But at one point, not prescribing antihypertensive medication, it's actually the worst thing that you can do because your brain is getting
Hmm.
ruined, your heart is getting ruined little by little. So our fears about what medications can do, we need to put it in balance of the impact of not getting those medications. And there's some people who are going to need medication no matter what. You can try to avoid it, but it doesn't mean that you're doing what you need to do. And medication can be combined with other things that
Hmm.
can be helpful at the same time.
Yes, you made me think how we see the difference in the way we see, an illness like cancer or diabetes or other diseases, and the way we see, addiction, depression, anxiety. We look away sometimes, it's hard to sustain sometimes those diagnostics, and that's exactly what we need to do to open our minds and the way we see those as diseases just like others.
And,
And
and, and let me, I agree 100%, but I'll add something else. One of the worst diseases to have as a second illness is mental illness. So
mhm,
people who have HIV, cancer, hypertension, diabetes, and they also have a mental health problem, they do worse than people who do not have it. There's even studies that show that women with cancer who participated of properly run support groups and even their family members were part of that had a higher, a longer life than those that were not receiving that, which means that there is something that is very valuable. We also
mhm,
know different mental illnesses have actually inflammatory processes that are very biological and that we could treat it. So inflammation can create illnesses,
mhm,
mental illness, depression, and anxiety. We used to know this. Now we know more details about some of the ways that inflammatory, immune responses can actually worsen mental illness. And that's totally biological. Uh,
mhm,
and even if I'm trying to talk to you nicely and I do what we need to do, at one point, if we know that there is an inflammation, we need to figure out how to take care of that. We're not there yet, but we're getting there. That's very clear data coming out now. And we need to figure out how to transform how we look at illnesses. Looking at mental illness in a clear, open way, not like it's a weakness, not like what people are going to say about me, or how bad I feel that I cannot do what I'm supposed to be doing. Because it's also, the stigma is also towards self, it's not others towards you. We can be stigmatizing ourselves for not being better, for how we're weak and we feel ashamed of what's going on. And it's because we create a system of looking at it. If you think of HIV, right, was one of the most stigmatized illnesses. And one of the changes that happened was that people with HIV decided, I'm not going to be afraid of having HIV. I'm going to make sure that we get care, and I'm going to be open about it. And that transformed even the medical field, because I don't know if you know, but medications would take 10 to 20 years to figure out what medications would do. The labs would go very slowly. There was a push by people who were HIV positive, said you don't have time, you have to do it faster, and we create medications much faster and as safe or more safe than we did before. Definitely there's something that it's like our mindset is one thing that we need,
Hmm.
but it's harder to do it. But
Yes.
way governments deal with it is also very important. There are some governments, some of them assume that mental illness is a weakness, and we talk about it in a way that makes anybody who has mental illness feel like I'm a second degree citizen. So the rhetoric and the system has to find a way of looking at it. But I don't know that you and I can impact that, but you and I can impact the group around us and how to figure out together to make some changes and influence at least the people around us, because it's very hard to for everybody to influence higher up.
Yeah, and that's exactly the opportunity we see at COEX Space, precisely to raise this awareness, to reduce stigma, to foster that collective well-being, even though we're not in the system, we're not, even though we are not able, to do other maybe larger things. But we can inform, we can connect to each other and see options and other doors, because like you said, one of the most important reasons we don't seek for attention is because we see in ourselves that illness as a weakness, or as I need to do better, or we reject our own diagnostics. And that acceptance and that understanding that we can be, and it's part of life, and now we're seeing it more and more common in societies. So these conversations are a huge step towards that.
But Vivian, let
And
me challenge you a little bit. I
okay.
actually think that you may have more reach than you think. I'll give you an example. I was very lucky that I went to a very poor country, Mozambique, and I was training people to do work with HIV and mental health. And one of the people that was in my training was the director of mental health for the country. I saw that as an opportunity. Wow, I'm talking to the person who's in charge of mental health. And that helped transform the system there.
Hmm.
I do think that you guys could bring into your summit people who have the power to transform
Hmm.
systems, and ask them and talk to them about it and prepare them and not challenge them, but stimulate them and nurture them to think in a different way. I think that would be one goal that you guys could have. That, and I'm not saying to transform what you're doing, is to add that because you may reach the individuals that would be able to think about this. It's not to change their minds, but okay, let's stop for a minute. I know that they may be harder to get them to talk to you, but sometimes we can try and we get them, and these people can be ambassadors, can influence much more than others. So I don't know. Let's think about that for what you guys can do, which I think you can, by the way.
Yeah, and that's the goal. We're doing a lot of research on that, on different perspectives. Scientific perspective, artistic perspective, professional, entrepreneurship, technology. We're getting all of that together to support that idea precisely. And we'll see, like you said, we're open to that 100%, because like you said at the beginning, the health systems and other systems are getting short of what we're living in right now. And we are the people, we are the society, we are connected, like you said, in our own environments and opening to others. And now we have this technology that we can inform so quickly, so fast, that's open, like you said. We can have this conversation and it can get to Africa, like you were in Africa, and other poor countries, to open their minds and be an ambassador for mental health. And that's beautiful. Thank you for mentioning that. I would like to end this conversation asking you for a key message about mental health that everybody should hear, and what can we do. We were talking about what can we do, but maybe a few steps, simple steps that we can all do.
The word that came to mind is normalize what we consider abnormal. We need to think this is a part of life within homes, within families, within yourself, to be able to tell yourself, this is, I may have a problem, but I'm not abnormal. I'm normal. This is the norm in, a percentage of the population is expected to have this or that. That is a way of looking at life without being afraid of what you have, more afraid of what can do to you than that you have it, right? If you have cancer, you're afraid because you have cancer, but you're not afraid that, why do I have cancer? You can ask those questions, but the fear of abnormal, create an abnormality about something that it's a norm, even though it's an illness, but it happens. It's part of what we're expecting. So normalizing within families, within people, within communities that this happens. And
Hmm.
therefore it's the norm. It's normal that it will happen. Then we need to do something about it. We need to think about it. And I always think of community. And for me, the word community is very important. So is communities normalizing it as a way of, communities may have leaders, may have people who can influence their own communities. You can think religious, you can think other types of communities. We need to have a message that it's not about, strength and being good. You can be strong and good and still have a mental illness. It doesn't eliminate it. So I think normalizing it's a very important part of this process. So then we will see it's about what we can do then, and not, oh, do I have it? I should not have it, etc. Because there's a process there that can take so much energy and
Hmm.
years. So my word is normalizing mental illness, that it happens and we expect it, and then we should take care of it.
Milton Weinberg, thank you so much for being here for this conversation. And I look forward to continue with other topics about mental health and the future of humanity in a better world. Thank you so much.
Thank you, Vivian, for having me. Take care.